Every 40 seconds, a person takes their own life. Everywhere in the world, poor mental health is a leading cause of suicide. We must focus on global mental health. Have we forgotten it in our development policies? Even before the Universal Declaration of Human Rights was adopted in 1948, the World Health Organization had made it clear that the concept of health also included mental health. Here in Norway, the history of psychiatry is more than 150 years old. We do not have to look far back to a time when we still were blindly experimenting with the lives of psychiatric patients. In the 1800s, mental hospitals and asylums were set up. A lack of knowledge on mental health resulted in crowded asylums, isolation, coercion, and abuse of sick people, the majority of whom were poor. At the end of the 1960s and in the early 1970s, more humane and effective treatment methods began to be used. Now we are working on the prevention of poor mental health and on ensuring that the right kind of treatment is available for those who need it. We have come a long way in accumulating knowledge and removing stigma. We see the whole person, and that is something we can export. Around 800 million people in the world suffer from mental disorders. 80% of them live in low and middle income countries. As much as 80% of these people lack access to mental health services. And this number is increasing. Within a global perspective, mental health is still a neglected and stigmatized area of medicine. People with mental health issues are experiencing an increasing degree of marginalization. People with mental illnesses are too often denied their rights, put in chain, tied to trees, chased into the woods, or freed from evil spirits with violence and prayers. These are gross violations of human rights. We can contribute knowledge around the destigmatization and normalization of mental health issues. Few countries have greater openness around mental health issues than Norway. We understand how wrong it can be if the mentally ill are treated incorrectly or do not receive any treatment at all. By 2030, mental health issues will be the most common cause of early death. The world's health budgets are not keeping up with this development. Norwegian development policy can do something about this. We can make a big difference by removing stigma and providing information to health workers. Preventative work can save many lives and contribute to more people being able to unleash their potential, such as in Peru, where SOS Children's Villages hold parenting courses and provide psychological counseling. In Nepal, Forut and local partners have built the country's first ever child psychiatric clinic. The clinic provides help and knowledge on children's mental health for health workers and parents across Nepal. Mental health care can, for example, help a girl who has suffered abuse to access education again, or prevent a mother who has lost a child to malnourishment from giving up on her other children. For people who have nothing left, this type of help can give them the strength to not give up and to continue to be there for their loved ones. Over the course of this film, 7 people have taken their lives. The alarm bells are ringing, and we have no time to lose. We can save more lives by focusing on mental health.